Welcome everyone to the Open Day Nursing Panel. We're going to run through some frequently asked questions about studying nursing. We'll give you an idea of what your study options are available to you, and also talk about what a career in this field might look like once you graduate. Firstly, I'd like to acknowledge we are on the lands of the Bundjalung Nation today and pay my respects to elders past, present, and emerging. Today I'm joined by student Claire, graduate Sophie Longworth, and Professor Janine Greenhill. Hi everyone, can I please ask you to tell us a little bit about yourself and what brought you here, or what's connected Southern Cross University to, I guess, your experience? Claire, we'll start off with you.
Hello everyone, my name is Claire. I'm a current third year Bachelor of Nursing student, so due to finish my studies at the end of the year. I chose nursing at Southern Cross just because of the location and the state-of-the-art facilities.
I'm Sophie. I'm third year out. Studying Southern Cross was once again for the location and the studies. A lot of my friends were coming here because I grew up locally, and obviously it's very close to the beach, so that's also a huge benefit.
Hi, I'm Janine Greenhill, and I've been the chair of nursing for 4 months. So I only just started here in February. Came from South Australia, where I was the head of the Rural Clinical School. So very strong and keen on rural health, and really proud to be back in where my grandma actually lived, just down here in Balinga. I just feel like coming home. It's fabulous.
Unreal. And Janine, could you start by explaining the two main nursing courses we offer here at Southern Cross at the undergraduate level?
Yeah, so we have a 3-year Bachelor of Nursing program. Sitting in the audience, just over there, is the coordinator. So if you'd like to ask Lucy some questions afterwards, that'd be fine too. So our 3-year program is accredited with nationally, and it means that you can actually work internationally. Australian nurses are really well regarded internationally. The 2-year enrolled nurse pathway is a course that's integrated into the Bachelor of Nursing. So you do 2 units that are modified, and then you join with the Bachelor of Nursing, so you all graduate together as a cohort. The program is really exciting. We're about to launch a brand new curriculum next year, which we're very excited about because it's quite novel. In the olden days, we trained in hospitals, and the Bachelor of Nursing programs were then like a degree program, any degree program where you were studying several subjects per year. The new program is focused on just 2 subunits at a time, and it means that you can really get into the study, and we've got fantastic facilities. Some of you might have already been on the tours and seen the mannequins that we've got that brings learning to life and the experiential learning. And we've got fabulous clinical placements. So those 2 programs are some of the, I think, showcases of the university.
Yeah, the EN to RN pathway program is a really great program. If you are already a accredited diploma of nurse or an enrolled nurse, depending on your AQF type of diploma that you have, you can apply for this EN to RN pathway program, and that means it's only a 2-year fast track for you to be a registered nurse. And something quite unique is that dual regency when it comes to New South Wales and Queensland Health, so obviously career outcomes are really high as well. And Claire, obviously you're coming up to graduating, I think any week now. It's like 4 weeks away. You were talking to me not too long ago. What was your pathway into university, and what is your experience like? Have you been in the workforce already?
Yeah, so I did a Certificate 3 during year 11 and 12 in high school, and Southern Cross recognised that Cert 3, and I gained entry into the Bachelor of Nursing. I have already been on placement, so we do around 880 hours of placement throughout the 3-year degree. I've already done medical, surgical, mental health, and a couple of rural placements, and those placements are in all different specialty areas, and the reason being behind that is that you can kind of catch a glimpse of the different areas. So once you finish, you know which area you might want to specialise in.
And we're going to touch base very soon about where you want to go and I guess where you are currently at now. And we are joined by Sophie here. And Sophie, you're a past student with us and you studied on the Gold Coast campus that I'm aware of. And what was your experience like, and why was Southern Cross University the right university for you?
I found being at Southern Cross quite a relaxing environment to be studying in. As I said earlier, a lot of my friends were already studying here, not specifically nursing, but other classes, other degrees. So you're able to, in between your classes, you're able to go sit in the courtyard, you're able to hang out. Usually there's a lot of food trucks around, so there's always lots of snacks, which gets you through those long days of studying and those exams that you've got to get through and all the assignments that you've got to study hard for. Southern Cross, I found they do excellent clinical labs. I found they were very useful for before I went to placement. It gives you a glimpse of what you get to be experiencing whilst you're on placements. Also, I find a benefit is a lot of the lecturers or the teachers that are teaching us are already nurses or previous nurses, so they've got so much knowledge and experience in the field already that they're able to give you a glimpse into areas that might interest you, plus the information that you're learning. You study a lot, did a lot of assignments that link up with the clinical lab, so you can put two pieces of the picture together and it makes more sense, I found.
And obviously those placements really cement where you want to go with your career as well, because it sounds like you get a bit of diversity in your placement experiences. Now, Claire, talking about, I guess, working in the industry already that I'm aware of as an AIN position, how do you gain that qualification while studying? And is that more relative working in that sort of role versus, for example, myself, when I was at university, I used to work at Burleigh Macca's. I've done my time. I'm sure a lot of audience members can relate to that. What was the importance of working as an AIN and already in the field, and how did you get that qualification?
Yeah, of course. So as I mentioned, I did a Certificate 3 in Year 11 and 12. Otherwise, you can get an assistant in nursing or AIN position in your second year as an undergraduate student. Or third year, a lot of the health services in the area will employ you as on a casual basis, and whether that be one-to-one care for a high-risk patient or a float, depending on the setting you're in. But you can definitely work as an assistant in nursing in, again, hospitals, aged care, community work, agency work. A lot of people will do agency and you go to different facilities each shift. But I found it really beneficial to be learning and working in the industry as well as doing my studies, because it complements it perfectly, but you're also out in the industry meeting people, making connections and networking, and then by the time you go to apply for a job, at the end of your degree, you've already got, say, 2-3 years experience and know people in the industry. So it's really beneficial.
Just before we jump into talking about the career outcomes and I guess where you can go with your nursing course, when it comes to those placements, and you've mentioned you've done some rural placements as well as local placements as well, how are these organised? Do you have to seek them out yourself, or does the university organise them for you?
No, so the university organises all of our placements. The health placements team are outstanding. They facilitate that, and they're in state New South Wales or Queensland Health, as well as private organisations. And some exciting news in the future is that we've just partnered with one of the local private organisations to provide a cadetship program. But definitely organised by the university. There are some prerequisites that are required, like your blue card, national police check, that are really important to get onto prior to, as you enrol. Is that the question?
I think so.
Thank you.
Yeah, no, I think, and that's a big thing, because I think we have a lot of members here who may be looking at multiple institutions going, how does placements work? It is a big chunk of your time. It requires a lot of work, physical work, but how do I get there in the first place? How do I create these relationships? And knowing that Southern Cross University has a fantastic partnerships who really give a partnerships team that really go out of their way to organize the most beneficial placement for you, locally or rurally. And something to raise, guys, if you are, you never considered rural placement, I'd highly think about it, because there's a lot of support services aligned to you, depending on there's discounted accommodation. Sometimes they give you a little bit of money per day to help you live and everything like that. Claire, can you talk about your rural placement in terms of the support you received?
Yeah, so for sure. With rural placements, there are scholarships or grants on offer that can help you with the financial cost. Obviously, if you're travelling some way away, you're not able to work on the weekends, as if you may on the coast. But also, accommodation is supported. There's a few organisations that will offer your support, and the preceptors out there, they're really great. Obviously, trying to encourage students to go into rural because there's a massive demand and often shortages. But I found it outstanding. I've done one 3-week placement out west, and I've got another 4-week placement coming up. But just the broad range of skills that rural nursing offers, there's so many advanced skills, because oftentimes you're one of the most qualified people on shift. So it really teaches you to really develop your critical thinking, that independence and knowledge. So I wouldn't recommend it enough.
So if you're someone who thrives in a high-strung environment in terms of rural and taking on those opportunities where you're really going to get more skills out of the same amount of, hours placement, I'd highly recommend it. Obviously, this sounds like there's a heap of opportunities of support available to you, from scholarships to discounted accommodation or anything like that. I'd highly recommend doing it, and something that looks fantastic on your resume as well because of those extra skills. And now we want to talk more about where have our students gone on to do. And so you're just letting me know that you're obviously working locally and you gained obviously graduate employment locally, which I guess for some of our students, they want to stay locally. They don't want to have to move away if they don't have to. Can you tell us a little about your career, and did your placements or your university experience really help you decide what you wanted to do as a career?
I was very lucky to have got a grad position at the Tweed Heads Hospital. That was my first preference. I did try and do a fair few placements there because I live locally. I did also branch out to the Queensland facilities as well for some of my placements just to have a look, but I did like the way that the New South Wales system ran, and I was definitely more comfortable in that environment. I went on to do my graduate year on the surgical ward once again at Tweed. I've stayed there for my whole career thus far. It's a great environment. You've learned a lot. The staff are great. And then I've slowly made my way down to the emergency department by doing extra studies and extra programs that the hospital have offered for me. And once I've made it to the emergency department, I've then gone on to do some more studies within the department to be able to do such things as advanced life support. And then I'm able to assist with the more critical patients that are coming in straight off the street from the paramedics that are critically unwell and need our assistance. At the uni, once again, as I said, some of the teachers stay local, so they work local, they live local, so they're able to provide that insight to you. And they've also got the private and the public sector under their belt, so they can inform you of what they think is best. They can give you the benefits and the cons to both departments. I have family, so my whole family are in the health department. My mum is an emergency nurse, and unfortunately I tried really hard not to follow her footsteps, but here we are. I've always just grown up and I've got a community-based mindset. I've always wanted to be that kind of person that helps people, so then I've just branched out. Unfortunately, ended up in nursing, but I love it. It's one of the best careers I've ever had, and I hope to have a very long and prosperous career.
Unreal. And Janine, what have other graduates gone on to do? Obviously it can be quite diverse.
Yeah, well, as I said before, the world's your oyster. You can specialise in global nursing, so you can go and work with Medicines Sans Frontières overseas. But we would love to keep you locally as well. Fantastic opportunities in mental health. We've got some of our team are mental health nurses, and so a lot of people go on to mental health. In fact, I just this week met the director of the new Flying Doctors Mental Health Service, who's one of our graduates, and I'm very proud of her. One of the people that Nikki was talking about on the panel yesterday in Lismore was somebody who's gone on to work in the film industry as a nurse, and of course, it's anywhere there's health, there's a nurse. So it's a really exciting career. A lot of people are actually starting to develop their own businesses even as nurse practitioners, and that's something for the future, I think.
Yeah, I know cosmetic nursing is also getting very popular, and you can do postgrad qualifications, which is, some of our, graduates love working in the hospital setting, but then get into a lifestyle situation where the shift work is not working for them if that's how they're set up, and moving into other industries that include nursing where they are maybe more 9 to 5 if that's what they're seeking for. You can branch out and change again by utilising your qualification, which is really cool. It's quite diverse.
Yeah, and things like primary health and telehealth, the technology that we've got in nursing and the way in which we can teach people with the newest ways of delivering health services, it really does show that nurses can actually create new jobs for the future. And so it's a really exciting thing to be on.
And Janine, I just got one more question. I spend a lot of time working with high school students, especially here in Queensland, and there's always a conversation of, I want to be a paediatric nurse, or I want to work specifically in mental health. And Sophie, you may be able to answer this one as well, moving in the graduate field, is do students need to study that postgrad specialised qualification straight away, or can they enter into these wards, gain hands-on experiences, then upskill themselves while they're in that sort of space? Sounds like you've worked in a couple of different wards already. Any feedback for those students who are looking at that specialty set of skills?
Yeah, well, our recommendation is that most people apply for a graduate nurse program after they've graduated, so they can consolidate their skills and get support and not only learn to be a good generalist nurse, but it's almost like a stem cell. You can actually learn to find out where your passion is by doing a graduate nurse program. But some of our students are passionate about being a particular style of nurse. So the way that I see the future is for us to have programs where you select where you'd like to go in the future. And so this year we were able to give them the option of if you wanted to be a rural health nurse, to go into a long-term placement in rural health before you graduate, and then articulate that up with your postgraduate studies. And we've got a postgraduate diploma in masters in mental health nursing and a masters in leadership as well that people can pick up right here.
So it's more about those practical skills in that sort of area. You don't need to be like, oh, I'm doing Bachelor of Nursing, majoring in pediatrics or majoring in mental health. It's all about those hands-on learning skills and where you've spent that clinical work experience as well as what you've done throughout your degree, and then go on to a graduate program where you get to have a further taste test.
Well, the degree's very flexible, so you can do either. Okay. If you want to be a mental health nurse and your passion is in mental health, you can actually choose that pathway for yourself.
Unreal. And just for Sophie and Claire, since you guys are kind of freshly out of university in the last few years, is there any advice you would pass on to any student who's looking at, branching out into nursing or looking at enrolling in the next couple of years?
Well, considering I finished at the end of the year, a few things that I wish I'd probably been told before I started, but a massive thing is looking at graduate employment. Obviously, nurses are in massive demand, but choosing an institution that obviously offers registration in both states and that offers placements in the two different states is a massive draw card, especially when it comes to applying for graduate positions, as well as working in the industry if you're able to. Not only is it financial benefit, but it just consolidates what you're doing in classes. That's probably what I'd say, but just every opportunity you're offered, whether that be on placements or through the university, education or in services while you're on placement, just jump at it and ask lots of questions, because nursing is so diverse and there's so many different avenues you can take it in. It's really about finding the area you're passionate in and working towards that, and you'll go everywhere.
Sounds very practical, which I think that's my favorite part. I'm a very practical person myself. I'm not someone who can really sit behind a desk that well. Sounds like a very rewarding degree, and the practical side, besides obviously the amount of theory you guys have to learn, you jump into it quite early in your course, and therefore you know exactly where you want to go with it. It's kind of motivating in a way, obviously being those practical settings while getting the theory done. Do you have any final piece of advice to, potential students who are looking at going into nursing, Sophie?
I think it's just important to realise that even if you think you might want to do nursing, you don't actually have to know what you want to do. That's the benefit of doing so many placements. You could go up the coast, you can go down the coast, you can go west. You can go wherever you want. You can do every sort of different area just to see what you like. And even if you haven't found that place that you love, you then get your grad year in a basic general ward, and then you go on from there. And then, as mentioned earlier, you can go on from there. If you do like pediatrics, you then do your grad year in a general ward, and then you apply to do a position at Brisbane and get a job there. So you can go anywhere. The shift work scares people, but shift work is better than 9 to 5. I can guarantee that. You can sleep when people are out. You can be out when people are asleep. It's for your lifestyle as well. But then again, if you want the 9 to 5, there's jobs for the 9 to 5. You can do Monday to Friday in nursing. I know you don't think you can, but you can. There's positions everywhere. It's in really high demand. The nurses that are out there now are working really hard, so we do need more nurses at the moment. It's a great job to have. The benefits outweighs the negatives. I wouldn't want to work anywhere else.
Yeah, I have a friend, Joanna, who just graduated in the last couple of years, and she does 3 night shifts a week, and it counts for 7 days work pretty much. And so it's not bad. It works really well for her and her partner's dynamic on how they're trying to balance everything else in their lives. And I thought that's fantastic. If you can make that work and work that night shift and earn that better money and work over a shorter period of time, it's fantastic that there's so much flexibility that you can be kind of in control of, I guess, your work hours and what your lifestyle can look like. So it sounds very flexible and rewarding, and obviously you can go global as well. Thank you so much for joining us here today. If you are looking at applying for our program and you are a school leaver, so you're finishing year 12, I highly recommend looking at our early entry program. We have a fantastic fee-free application early entry program that's based on your school recommendation, not just on your ATAR result. Applications are closing in September and looking at finding out around November period. So it usually lines up with your last week of school. It's a fee-free app. It's not connected to QTAC or UAC, so there's a lot of flexibility in that. If you'd like to know more about that early entry program and you are in year 12, feel free to go to our service desk. We have a whole team of student ambassadors and team members like Claire who will be there to answer all those questions for you there. If you're a mature age student and you're looking at applying for Southern Cross University, feel free to go to our service desk or talk to our client services teams who are joined here today. They can talk about your study options and how to apply. You don't need to apply through QTAC. Once again, you can actually apply directly to our university fee-free. And our next intake is coming up in term 1 next year with the brand new calendar model. And that's everything from us today. If not, call our Future Students team on 1-800-626-481. We'll be more than happy to talk to you. We're open Monday to Friday. If you'd like to talk to these panelist members, feel free to meet them outside. They're going to stick around for an extra 15 minutes and they can talk to you more one-on-one. Thank you guys. Enjoy your afternoon.
Can I just say that at the front too, we've got our midwifery coordinator and our EN coordinator has just walked in as well. So any of those 4 would be fabulous to talk to as well.
Amazing. Thank you so much. Cheers, guys.